As more people are contracting and being diagnosed with COVID-19, doctors are finding concerning symptoms unlike what they've ever seen before, including strokes in 20-year-olds and blood clotting. In tonight's Local Original, I spoke to one of the leaders of Duke's coronavirus task force about what this means.
We're going to continue to find new things about this illness over the incoming months.
Among the things Dr. Cameron Wolf is referring to include the potentially fatal drop in oxygen levels in some who are infected but not showing any symptoms, blood clots and strokes in younger people.
You get a 20 or 30-year-old who comes forward with a diagnosed stroke. That's incredibly uncommon. So there's, that is worth much more significant investigation. We've not really seen that in sort of other similarly severe end of the spectrum respiratory illnesses.
Dr. Wolf is helping to lead Duke's coronavirus task force. He says the fact they are now seeing patients with blood clots is changing how they treat them.
So the way we're sort of trying to tackle it here is to say, look, we're not 100% sure what the real clinical implication of that is. So let's treat these most inflamed, most unwell individuals in the same way that we do other sick folk who come in with higher clot risk. So for example, if you come into any major trauma center having had a car accident, for example, you're immobilized, you've got lots of injuries, we know in that group, trauma patients have a higher risk of developing clot. And so we treat them with blood thinners at low levels accordingly. Same here.
As for a vaccine, Dr. Wolf says don't expect one this year.
And I think what that does mean is that places like North Carolina that have done a really good job of keeping COVID to a minimum need to be conscious that we've probably only had maybe at most 10 or 15% of our population who've been exposed to this and had any chance to develop any immunity. So that leaves a lot of us still at risk. And I think, we will not be reverting to a 2019 normal for the remainder of this year. That's what we're planning for here in the hospital and on the university campus. And that would be what I would probably leave people with, this is going to be with us for a good long period of time.
Now, as for the instruments available to test those oxygen levels, consumer investigator Steve Sprazier has a brand new story about how you can get one or try to get one at CBS17.com.